Let's talk about vitamin D. It's certainly become one of those things that's overhyped, but at the same time, genuinely is very important. So it's important to understand. A lot of people treat it like some miracle supplement that prevents everything from cancer to depression, along with treating it. Other people just dismiss it because they assume everyone is low anyways, and like most things, the truth is somewhere in the middle. Now, it's called a vitamin, but it actually really acts like a hormone or a hormone precursor. When your skin is exposed to ultraviolet B sunlight, it produces vitamin D, or a certain form of it. That then goes to your liver and kidneys, which convert it into its active form, which is then going to work on many different parts of the body to do its thing. Now, the interesting thing about vitamin D, when you think of vitamins, you generally think of stuff that we're getting from our food or general intake, but our main source of it has actually been sunlight. And that's one of the reasons that vitamin D deficiency has become more common in modern life because we spend way more time indoors than our ancestors did. A lot of people live in northern climates where winter sunlight isn't strong enough, and even in the summer, they're not getting as much as we used to or that we need. And that's why in Canada and the northern US, through October to March, basically, you could stand outside all day and you wouldn't get enough vitamin D just because the sunlight isn't strong enough at that point. Now, as far as its functions, a lot of people just assume bone health, and that's true, but that's only part of the story. There's a lot of functions that vitamin D has throughout the whole body. It's going to help your body absorb calcium and phosphorus from your intestines. So even if you're having lots of calcium in your diet, if you don't have enough vitamin D, that alone is not going to support healthy bones. So if you're too low in vitamin D, you might develop osteoporosis, osteomalacia, which is basically soft bones in adults, rickets in children, increased fracture risk. But as I said, it's not just about the bones. You have vitamin D receptors throughout the body on your immune cells, your skeletal muscle, your brain, your blood vessels. It functions all over the place. Now, as far as measuring how much vitamin D you actually have, there is a blood test that you can do. It's called 25 hydroxy vitamin D or 25 OHD. And this is just the storage form, and it's the way that we check people's vitamin D levels. And the units are a little bit different. In Canada, it can be nanomoles per liter. In the US, it's generally nanograms per milliliter. But regardless, the lab usually gives ranges for what's normal and what's not. And you can take a look at this chart here, courtesy of AI. It's a nice breakdown of generally how vitamin D deficiency is defined. Different labs have slightly different cutoffs, but this is a pretty good general rule of thumb. Now, the key point is that based on the current research for bone and general health, 20 nanograms per milliliter, or if you're in Canada, 50 nanomoles per liter, is usually enough for the vast majority of healthy people. Chasing higher and higher numbers doesn't necessarily mean that's a good thing. There's no strong evidence to suggest that much higher numbers are doing much better. And there are harms that you can have by having too much vitamin D, and we'll talk about that later. Now, like we talked about earlier, you have vitamin D receptors all over the place, and it's being presented as this cure-all. So does it actually affect your immune system? And the answer is yes, but there's levels to how it does that. So if you remember from grade school biology class, we have an innate immune system that we're born with. It's our first line of defense. And then we have our adaptive immune system, which is a specialized response that develops after an exposure to some kind of pathogen. Now, people who are deficient in vitamin D, it has actually been shown that they're at higher risk of acute respiratory illnesses. And when they do get respiratory illnesses, they can end up sicker and have worse outcomes. So if they're deficient, you can think of the immune system not functioning as well, but that's quite a generalization. You have to be very careful when it comes to claims in medicine and healthcare. Causation is not the same thing as correlation. Just because something is correlated to something, it doesn't mean it explains the entire idea on its own. There's often a lot of co-founding factors. If somebody's deficient in vitamin D, maybe the rest of their diet isn't very good and they're deficient in a whole bunch of other stuff. Maybe they're eating very poorly. Maybe they also smoke, they also drink. I'm just making things up, but the point is to illustrate that there's no one thing that's a cure-all or a panacea when it comes to these complex functions in the body where a lot of things have to go right. So yeah, in somebody deficient in vitamin D, if they bring their vitamin D levels up, there is evidence to suggest that it improves their immune function. But if you already have normal levels of vitamin D, taking massive doses to go way above normal isn't increasing your immune system power to make you invincible or something. So be careful with what you see on social media. When it comes to a lot of these health supplements and topics, you're not necessarily aiming for more and more and more. You're just aiming for adequate. You want to give your body what it needs. You don't want to pump it up with way more than necessary. Now, there are some other areas where vitamin D has been researched, and there's some interesting findings. There's some research to suggest that people with low vitamin D They were found to have higher rates of numerous diseases: depression, cardiovascular disease, diabetes, autoimmune, dementia. But remember, just be careful with that, what we spoke about. Association between factors does not mean causation. It does not mean that vitamin D deficiency alone is causing all these problems. Just common sense wise, people who are older, less active, chronically ill, or they spend less time outdoors, they're going to have lower vitamin D levels, but likely a lot of other things going on as well. So based on the current research, people who already have normal vitamin D levels, over supplementing them did not reduce the risk significantly of heart attack, strokes, cancer, or overall mortality. In the 2024 Endocrine Society guideline, they concluded after they did their trial that for healthy adults from 18 to 74, taking more than the recommended daily amount does not clearly prevent disease, and routine blood work is not necessary. So now when it comes to how much you actually need based on the United States Institute of Medicine as well as Health Canada, these are the guidelines that they've currently put out. And as you can see, it changes based on your age, and this is assuming minimal amounts of sun exposure, which again, in the Western world, that's going to be a whole lot of us. A couple things to note here. Health Canada advised that all breastfed, healthy, full-term babies get 400 units of vitamin D supplement daily from birth throughout their first year, because breast milk alone won't provide enough. And there are a few groups, as you can see, where the recommended intake is higher. Children and teens, obviously because they're growing. Adults over 75, preventing bone frailty. Pregnancy, as well as, interestingly, people with pre-diabetes. There is some evidence to suggest that vitamin D may help in that scenario. Now, when it comes to the question of should you get your vitamin D level checked, again, based on the current guidelines, the answer is usually no. Routine screening of healthy adults isn't really recommended by many organizations because it hasn't been shown in these studies to improve health outcomes. But one thing that I will say is that these massive studies and trials, they're good. They're good to get evidence, but individuals are not studies. So this is why it's important to be an advocate for your own health and make your own decisions. I don't tell patients what to do. I'm not there to parent them. I'm not there to impose my beliefs on them. All I say to them is, hey, here's the evidence. Here's what's suggested. Here are the options we have. What would you like to do? And then ultimately you make your own decision. If you're healthy, you eat well, you take the daily recommended amount, I don't really see a benefit to doing blood work. If you're curious, you want to know, or obviously if you're having any kind of symptoms, then it's a reasonable test to do. There have been lots of times in the urgent clinic where I've had patients with very generalized complaints like fatigue, brain fog, and we end up testing their vitamin D. They start a supplement and they feel immensely better within a few months. There are cases like that. There are other cases where somebody is convinced that they're low in vitamin D. We get their tests done, they're totally normal, and it goes nowhere. So it's important to understand these things, understand your own context, and make your own decisions along with your discussion with your own physician. In Canada, vitamin D testing, like routinely, is not even covered by most provincial plans because, again, in healthy people, it doesn't change what you're going to do about it. It is covered when there's a medical reason for it or patients can pay out of pocket to have it tested. The important thing is to keep in mind the risk factors. So if you have osteoporosis, fractures, GI conditions that might prevent vitamin absorption, kidney disease, because remember, kidneys are involved in making that active form of vitamin D. If you're on certain medications that might interfere, if you've had surgery that might interfere with vitamin absorption, those might be reasons to have their vitamin D levels checked, but the average healthy adult, generally not needed. So it's just something to keep in mind. Now, as far as the sources of vitamin D, like we talked about, sunlight is very important, but you do have to be careful with this. It's going to depend on where you are in the world, what season it is, if it's even enough UV exposure for enough vitamin D to be produced. And the flip side is, obviously, with excessive UV exposure, it increases the risk of skin cancer. So you should never be out there intentionally getting sunburned because you want to produce enough vitamin D. Now, it can be difficult to just pull off from food alone. Certain fatty fishes like salmon, sardines, mackerel, egg yolks, fortified milk, fortified plant-based beverages. You'll notice at the grocery store, a lot of these things are fortified with vitamin D because people are aware that deficiency is an issue. But it can be difficult through food alone and for the reasons we discussed, sunlight alone, depending on where you live and the risks that go along with excessive sunlight. So if you are deficient or you're not meeting the intake, supplementation is usually pretty reasonable for people. It's a very cheap supplement, just over the counter at any pharmacy or a Costco or a Trader Joe's, whatever's cheapest. Don't fall for the gimmicks that, oh, this is super high absorption vitamin D or this is flavored. You don't need any of that. Whatever's cheapest, basic, doesn't have a bunch of garbage ingredients in there. Again, look at those ranges, right? The 600 to 1,000 international unit range comfortably covers you and you're well within the safe limits at that range. Obviously, this number is going to change based on your own situation, and you should discuss it with your physician. But generally, people end up going the supplementation route, whether it's vitamin D or just a multivitamin to cover all their bases. Now, I'll leave you with this, and that's taking too much. People often think that, oh, this thing is good, so I'm just going to take a whole lot of it, and that is not the right way to approach it. There are dangers to having too much vitamin D. So one thing to keep in mind is that vitamin D is fat soluble, so your body stores the excess amounts rather than just excreting them through the urine like vitamin C, for example. So currently for routine use, the safe upper limit is considered 4,000 units a day for anyone age 9 and up. But again, often, if you remember the chart we looked at, it's not even necessary to go this high unless you have an actual documented deficiency or a reason to. Sometimes we prescribe 10,000 units or 50,000 units weekly if someone is extremely deficient to catch them up, but it's not a long-term thing. And that's something where there's, again, documented blood work and specific scenarios under medical supervision. And having too much can cause a whole host of problems. Remember, it helps with absorbing calcium, so your calcium can go too high. That alone causes a whole lot of problems. Kidney stones, GI upset, you can get nausea, vomiting, confusion. It can affect the heart if you mess with the electrolytes like calcium. Like phosphorus, it can affect your heart rhythm. That can lead to death, kidney injury. So please, more is not always better. Be reasonable. Speak to your doctor. Adequate is what we're aiming for. So that's pretty much it for this one. Now you know about vitamin D, what it does, what it doesn't do. So be careful with what you see on the internet and people promoting products. Speak to your doctor. This is just for educational purposes. I'm not your doctor. Your situation is different, but I hope that helped you to understand what's going on and to be better informed to make your own decisions. Check out the newsletter and resources in the description. Let us know what you want to hear about next, and we'll see you next time. Take care.